Comment where you're watching from today, as this story of compassion and justice unfolds before your eyes. When a young woman's desperate situation brought a courtroom to silence, nobody expected what would happen next. The fluorescent lights of courtroom 3B cast their harsh glow over the morning's proceedings. Margaret Moore, the court clerk, had seen thousands of cases pass through these doors, but something about this morning felt different. The mahogany benches were filled with the usual mix of attorneys, defendants, and family members, all waiting for their cases to be called. Sandra Williams sat in the back row, her hands trembling as she held a stack of past-due medical bills. 8 months pregnant, she had been caught taking prenatal vitamins and food from a local store. Linda Hernandez, her public defender, had tried to negotiate a plea deal, but the store owner was insisting on pressing charges. Usha Vance sat at the prosecutor's table, reviewing case files with her characteristic thoroughness. Known for her fair but firm approach to justice, she had earned respect from both sides of the courtroom over her years of service. Elizabeth Garcia, the court reporter, noticed how Vance seemed to pause longer than usual while reading this particular case file. The tension in the room shifted when Judge Mary Robinson called the case. Sandra Williams struggled to her feet, her pregnancy making even this simple movement difficult. Thomas Clark, the store owner's attorney, straightened his tie and prepared to present their case for maximum penalties. Patricia Taylor, a social worker present for another case, watched as Sandra made her way to the defendant's table. The young woman's worn clothes and exhausted expression told a story that went far beyond the simple facts of the case. "Your Honor," Thomas Clark began, his voice carrying the practiced indignation of someone used to painting defendants in the worst possible light. "The facts are clear. Ms. Williams was caught red-handed stealing from a small business. The total value of goods taken was..." But he never finished that sentence. Sandra Williams, overwhelmed by the moment, by her circumstances, by the weight of her situation both literal and figurative, began to sob quietly. What happened next would be talked about in legal circles for years to come. Sarah Davis, a young intern at the public defender's office, watched in amazement as Usha Vance stood up. Protocol dictated that the prosecution would support the store owner's desire for punishment. But Vance had noticed something in those files that changed everything. "Your Honor," Vance began, her voice carrying a gentleness that surprised even her longtime colleagues, "I move to approach the bench." Judge Robinson nodded, and both attorneys stepped forward. The conversation that followed was quiet but intense. Karen Miller, the court bailiff, observed how Vance gestured to specific pages in her file, speaking with increasing animation. The judge's expression shifted from stern attention to something softer, more contemplative. What the courtroom didn't know was that Vance had discovered Sandra's full story in those files. Medical records showing dangerous complications in her pregnancy. Employment records revealing she had lost her job due to those same complications. Insurance denials. Rental assistance applications. A woman doing everything possible to survive and protect her unborn child. When Vance stepped back from the bench, she did something unprecedented. Instead of continuing with the prosecution, she turned to face Sandra Williams directly. The courtroom held its breath, waiting for what would come next. "Your Honor," Vance's voice carried clearly through the silent room, "the state wishes to withdraw all charges in this case." But she wasn't finished. "Furthermore, I would like to request a brief recess to connect Ms. Williams with the appropriate social services and medical assistance programs." Robert Harris, a veteran court officer, would later say he had never seen anything quite like what followed. Thomas Clark began to object, but Vance was already pulling out her phone, making calls to contacts at local assistance organizations. David Smith, who ran a community health clinic, arrived within the hour. Barbara Garcia from the Women's Support Center came shortly after. What had begun as a criminal proceeding transformed into an impromptu support session, with Vance coordinating resources right there in the courtroom. Judge Robinson, rather than calling for order, allowed her courtroom to become a temporary hub of assistance. Susan Jackson from the food bank arrived with information about their prenatal nutrition program. Matthew Robinson from the Housing Assistance Office brought emergency housing forms. The transformation in Sandra Williams was visible. The fear in her eyes gave way to tentative hope as she realized these people, led by the very prosecutor who was supposed to be pursuing her conviction, were actually trying to help. Sometimes, Vance explained quietly to Linda Hernandez, the public defender who stood amazed at this turn of events, justice isn't about punishment. It's about recognizing when someone needs help rather than handcuffs. Mark White, a law student observing court proceedings that day, furiously took notes. This wasn't just a lesson in legal procedure, it was a masterclass in human dignity and the true purpose of the justice system. Thomas Clark, still representing the store owner, found himself in an unexpected position. After witnessing the outpouring of support and understanding the full context of the situation, he approached his client with a different perspective. By day's end, the store owner had not only dropped all charges but had offered Sandra Williams a part-time job with flexible hours once her medical situation stabilized. The morning that began with the prospect of criminal charges ended with a network of support. Mary Lewis from the prenatal care program set up immediate appointments. Joseph Robinson from the Legal Aid Society offered to help navigate insurance appeals. But perhaps the most powerful moment came when Usha Vance spoke to the whole courtroom before proceedings resumed. Today reminded us that every case number represents a human story. Our job isn't just to prosecute crimes, it's to serve justice. And sometimes justice wears the face of compassion. The impact of that morning extended far beyond one case. Charles Rodriguez, a senior prosecutor, initiated a department-wide review of how they handled cases involving medical hardship. Karen Williams from Social Services established a new protocol for screening defendants for assistance programs before court appearances. As Sandra Williams left the courthouse that day, surrounded by people committed to helping her succeed, the entire room had learned a powerful lesson about justice, mercy, and the difference one person's compassion can make. Have you ever witnessed a moment when someone chose kindness over protocol? Share your thoughts in the comments below. Sometimes the most powerful form of justice is the kind that helps people rebuild their lives. The story of what happened in courtroom 3B spread through the justice system like wildfire. By the next morning, William Thomas, the chief district attorney, had called an emergency meeting of all department heads. The conference room buzzed with discussion as prosecutors who had witnessed Usha Vance's actions shared their perspectives with those who had only heard second-hand accounts. Nancy Anderson, who had spent 20 years as a prosecutor, leaned forward in her chair. What Vance did wasn't just compassionate, it was smart justice. We need to talk about how many cases like this were missing. Around the table, heads nodded in agreement. Meanwhile, at the community health center, Sandra Williams was receiving her first proper prenatal checkup in months. Michael Johnson, the senior physician, couldn't help but notice how different she seemed from the frightened woman who had stood in court the day before. Betty Anderson, the clinic's social worker, sat with her, helping to fill out assistance forms. Back at the courthouse, James Martinez, a veteran judge, approached Usha Vance in her office. "You've started something," he said, settling into a chair. "The question is, what do we do with it?" The morning's paper sat on her desk, the headline reading, "Prosecutors' Compassion Changes Lives." Patricia Perez, who ran the county's diversion programs, arrived with a proposal. She had spent the night reviewing cases similar to Sandra's, people whose criminal charges stemmed from medical or financial desperation. The numbers were sobering. Sarah Wilson, her lead researcher, had identified dozens of similar cases in just the past month. The ripple effects continued to spread. Lisa Garcia, directing the local Legal Aid Society, reported a surge in calls from other defense attorneys wanting to know about the resources that had been mobilized so quickly for Sandra. The question on everyone's mind was how to make this kind of intervention systematic rather than exceptional. Richard Sanchez, the store owner who had initially pressed charges, found himself experiencing an unexpected change of heart. That morning, he called Susan Moore, his business association's director, to propose a community support initiative. "We can't just be about prosecuting theft," he explained. "We need to be part of preventing desperation." By midday, Jennifer Thompson from the Public Defender's Office had organized an impromptu meeting with Mary Robinson and other judges. They were discussing new protocols for early intervention in cases where medical or financial hardship played a role. Daniel Taylor, the court's administrative director, took notes as they mapped out a more compassionate approach to justice. The media attention brought unexpected allies. Mark White, CEO of a local healthcare corporation, reached out through his assistant, Barbara Rodriguez, offering to establish a fund for emergency medical assistance. "If we can prevent crimes of desperation," he said, "everybody wins." Sandra Williams' story continued to unfold in powerful ways. Charles Lopez, a job training coordinator, worked with her to develop a plan for after her baby's birth. The community that had come together in that courtroom wasn't dispersing, they were building something lasting. Linda Wilson, a court observer for a justice reform organization, noted how the atmosphere in the courthouse had shifted. "It's like people remember they're dealing with human beings now," she remarked to Joseph Robinson, another regular observer. "The questions being asked are different." The change was perhaps most visible in Thomas Clark, the attorney who had been ready to pursue maximum penalties. Margaret Davis found him in the law library, researching alternative justice programs. "I've been doing this wrong," he admitted. "We all have." By week's end, Elizabeth Martinez had drafted new guidelines for the prosecutor's office, emphasizing the need to understand the full context of each case before pursuing charges. David Smith from the Public Health Department collaborated on protocols for identifying medical hardship cases early in the process. Sandra Williams' case became a teaching tool. Robert Wilson, a law professor, invited Usha Vance to speak to his students about the experience. The classroom fell silent as she explained her decision-making process that day. "Justice," she told them, "requires us to see the whole person, not just the charges." The impacts reached beyond the legal system. Anthony Jones, director of a local business association, organized a meeting to discuss how the business community could be part of the solution. Betty Hernandez shared her experiences working with families in crisis, helping business owners understand the desperation that sometimes drove people to steal. Even the court officers were affected. Karen Davis, who had worked security for 15 years, initiated new training sessions on recognizing signs of medical distress or hardship. "Sometimes," she explained to her colleagues, "the person who looks guilty is actually just scared and sick." Matthew Garcia, overseeing court services, worked to create a resource center right in the courthouse. "We need to make help accessible," he explained while setting up information kiosks. "People shouldn't have to get arrested to find out what assistance is available." The healthcare community stepped up as well. John Jones, medical director at the county hospital, established a special unit for coordinating care with the justice system. Lisa Perez managed the new program, ensuring that medical needs were identified and addressed before they led to desperate actions. Sandra Williams herself became an unexpected advocate. Once her health stabilized, she began speaking at community meetings, sharing her story with Mary Lewis's support group for expectant mothers in crisis. Her experience helped others understand they weren't alone. The store where the original incident occurred transformed too. Under Richard Sanchez's guidance, they established a partnership with local food banks and prenatal care providers. Sarah Garcia coordinated regular health screenings in their community room. What had been a site of conflict became a point of community connection. Christopher Anderson, a data analyst for the court system, began tracking the impacts of the new approach. The preliminary numbers were promising: fewer prosecutions for poverty-related crimes, higher rates of successful intervention, and better outcomes for both defendants and the community. Patricia Thomas, who had been skeptical of the soft approach, found herself convinced by the results. "We're not just being nice," she observed during a staff meeting. "We're being effective. This is smart justice." The change in prosecutorial culture was perhaps the most profound effect. William Moore, a junior prosecutor who had witnessed the original courtroom scene, found himself approaching cases differently. "Now I ask why before I ask what," he explained to his mentor, Nancy Thomas. "The story behind the charges matters." Sandra Williams' baby arrived 2 months after that fateful day in court. The delivery room at County General was unusually full, not just with medical staff, but with members of the impromptu support network that had formed around her. Betty Johnson, the labor and delivery nurse, had never seen anything quite like it. Mark Martinez, handling intake at the courthouse, noticed fewer desperate faces in the morning lineup. The resource center was catching people before crisis turned to crime. "We're preventing cases now," he told Sandra Smith during shift change. "That's better than prosecuting them." The media continued to follow the story. Barbara Harris, a local reporter, wrote a series on the transformation of the justice system. "What began with one prosecutor's decision," she wrote, "has become a model for compassionate justice." Even the physical space of the courthouse changed. Linda Hernandez worked with Daniel Harris to create a more welcoming environment. The stark corridors softened with information boards offering resources and help. "The building itself should say we're here to help," Linda explained. As weeks passed, the changes solidified into standard procedure. Margaret Martin coordinated with social services to ensure smooth communication between agencies. The barriers between help and justice began to dissolve. Sandra Lee, who had initially trained as a prosecutor but left for social work, returned to the DA's office to help implement the new protocols. "Now we can do both," she explained. "We can pursue justice and help people." The story's impact continued to grow. Other jurisdictions sent observers to study the changes. Michael Thompson from the State Justice Department visited to learn how they might scale the program. What had begun as one moment of compassion was becoming a movement for change. Have you witnessed a moment when one person's compassion changed an entire system? Share your thoughts below. Sometimes the greatest changes start with a single act of understanding. 1 month after the courtroom incident that changed everything, the impact of Usha Vance's compassionate intervention continued to evolve in unexpected ways. Jennifer Clark, heading the state's Judicial Review Committee, arrived to study what was now being called the Vance approach to justice. The courthouse had transformed. Where stern warnings once dominated the walls, Robert Harris and Lisa White had created resource centers with clear, welcoming information about available help. The message was clear: seek assistance before crisis leads to crime. Sandra Williams' story had become a catalyst for change, but she wasn't the only one benefiting. Mary Robinson, now coordinating with local healthcare providers, reported dozens of similar cases being diverted from prosecution to assistance. David Smith's community health clinic had become a hub of preventive intervention. Thomas Clark, the attorney who had once pushed for maximum penalties, now led training sessions on recognizing underlying medical and social needs in criminal cases. "We were fighting symptoms," he explained to Michael Thompson, a visiting prosecutor. "Now we're addressing causes." The changes reached beyond the courthouse. Elizabeth Garcia, managing the local grocery store association, initiated a program working with Susan Brown to identify struggling community members and connect them with resources before desperation led to theft. What began as prosecution prevention became community care. Patricia Jones watched the transformation from her position as court administrator. The new protocols had initially seemed daunting, but the results were undeniable. Case loads were down, successful interventions were up, and the atmosphere in the courthouse had fundamentally shifted. Nancy White, directing social services, found her department working in unprecedented harmony with the justice system. The walls between punishment and help had crumbled, replaced by a more nuanced understanding of human needs and community responsibility. Sarah Martinez, whose own pregnancy had once led her through difficult times, volunteered with the new Courthouse Resource Center. "When people come here afraid," she explained to Barbara Jackson, "they find help instead of judgment. That changes everything." The business community's transformation was equally profound. Mark Wilson, chairing the Chamber of Commerce, worked with Karen Lewis to establish a fund for emergency assistance. Prevention, he noted during a board meeting, costs less than prosecution, both financially and humanly. Sandra Williams herself had become an unexpected symbol of the new approach. Working part-time at Richard Sanchez's store while completing her degree, she helped identify other community members in need. Her experience informed the way the system now approached similar cases. Margaret Lee, evaluating the program's effectiveness, found compelling data. Recidivism rates dropped among those who received early intervention. The cost savings from reduced prosecution more than covered the expense of expanded social services. Charles Miller, the county comptroller, called it a win-win approach to justice. Matthew Harris, training new court officers, emphasized the importance of recognizing distress signals. "We're not just looking for crimes," he taught them. "We're looking for opportunities to help before crimes happen." Linda Gonzalez, who had initially criticized the approach as too soft, found herself convinced by the results. Working with Betty Smith in program coordination, she saw firsthand how addressing root causes prevented future offenses. "This isn't just compassion," she observed. "It's effective crime prevention." The ripple effects continued to spread. Joseph Martin, overseeing probation services, restructured his department to emphasize support over surveillance. William Sanchez developed new protocols for identifying underlying medical issues during initial court appearances. The system was learning to ask why before asking what. Even the physical space of justice had changed. James Thompson, the courthouse architect, worked with Anthony Anderson to redesign waiting areas and service points. The imposing barriers between court officials and the public gave way to more accessible, welcoming spaces. The media's interest remained steady. Daniel Lewis produced a documentary following several cases through the new system. The contrast between the old approach and the new highlighted how much had changed. Lisa Moore's narration captured the human stories behind the statistics. Sandra Taylor, who had once felt helpless in the face of medical debt, now coordinated with Christopher Lee to ensure that health-related cases received immediate attention. The partnership between medical providers and the justice system grew stronger each week. The transformation affected everyone in the system. Mary Ramirez, a veteran clerk, noticed the change in how people approached the courthouse. "They come in scared," she said, "but they leave with hope. That never happened before." The store where Sandra's case began had become a model for community engagement. Nancy Robinson worked with the staff to recognize signs of distress among customers. Karen Thompson managed a resource desk right in the store, offering information about available assistance programs. Usha Vance's original insight, that justice sometimes required help rather than punishment, had evolved into a comprehensive approach to community well-being. John Brown, studying the program's impact, found that the changes had strengthened community bonds while reducing crime rates. Daniel Clark, who managed court security, reported a noticeable change in the building's atmosphere. The tension that had once filled the hallways gave way to a sense of purpose and possibility. Even difficult cases now carried the potential for positive change. The legal community's transformation continued. Sarah Jackson, teaching at the law school, incorporated the new approach into her curriculum. Future lawyers learned to see their role not just as advocates or prosecutors, but as participants in community healing. The healthcare sector's involvement deepened. Patricia Anderson coordinated with Jessica Harris to ensure that medical needs were identified and addressed at every point of contact with the justice system. The artificial boundary between health and justice continued to dissolve. The story attracted attention from other jurisdictions. Richard Rodriguez came from the state capital to study the program's success. What had begun as one prosecutor's compassionate decision was becoming a model for justice reform across the region. As winter approached, Sandra Williams prepared to graduate from her degree program. The support network that had formed around her remained strong, but now she helped strengthen it for others. Her experience continued to inform how the system evolved. Have you seen how one person's insight can transform an entire community? Share your experiences in the comments below. Sometimes the most powerful changes come from seeing people's needs clearly and responding with both compassion and wisdom. 6 months after the day that changed everything, the courthouse hosted a unique celebration. Sandra Williams stood at a podium, her healthy baby daughter in a carrier beside her, addressing a room full of people who had become more than just court officials and social workers. They had become a community dedicated to transforming justice. William Moore, now heading the new Community Intervention Division, watched as Sandra shared her story with representatives from jurisdictions across the state. The young mother who had once stood trembling before the court now spoke with confidence about how one moment of compassion had not only changed her life but had sparked a revolution in how justice was administered. Elizabeth White, analyzing the program's first 6 months of data, presented statistics that told a compelling story. Case diversions had increased by 200%, while successful interventions had led to a 60% reduction in poverty-related crime. Margaret Martin, overseeing budget impacts, reported that the savings in prosecution costs had more than funded the expanded support services. Usha Vance sat quietly in the back of the room, characteristically deflecting attention from herself. Linda Robinson, who had witnessed that first transformative moment in the courtroom, leaned over to whisper, "Did you ever imagine it would lead to all this?" Vance's reply was simple, "This is what justice should have always been." The changes had rippled far beyond the courthouse. Robert Harris reported that local businesses, once focused solely on security and prosecution, now participated actively in prevention programs. Sarah Davis coordinated with Thomas Johnson to ensure that store managers knew how to recognize signs of distress and connect people with resources before crisis led to crime. The medical community's involvement had deepened significantly. Nancy Ramirez, directing the new Medical Legal Partnership Program, worked closely with Barbara Garcia to ensure seamless cooperation between healthcare providers and the justice system. What had begun as crisis intervention had evolved into systematic prevention. David Anderson, who had initially been skeptical of the soft approach, now led training sessions for law enforcement officers. "We're not just preventing crimes," he explained to Michael Smith's rookie class. "We're building a stronger community." The police department had become an active partner in connecting people with resources rather than just responding to crimes. The courthouse itself continued to evolve. Patricia Taylor worked with Karen Miller to create welcoming spaces where people could easily access help. The intimidating bureaucratic maze had transformed into a community resource center. Mary Lewis managed a team of volunteer guides who helped visitors navigate available services. Sandra Williams' original case had become a teaching tool. Jennifer Thompson used it in training sessions for new prosecutors, emphasizing the importance of looking beyond charges to understand underlying causes. Charles Rodriguez developed protocols for identifying similar cases early in the process, ensuring that help reached people before desperation led to crime. The business community's transformation was particularly striking. Richard Sanchez, once focused on punishment for shoplifters, now chaired the Business Community Support Initiative. Lisa Perez coordinated with store owners to create a network of resource points throughout the city. What began as loss prevention had become community care. The impact on legal education proved significant. Susan Moore developed a new curriculum for law students, incorporating lessons from what was now known as the Vance approach. Betty Hernandez guest lectured about the importance of understanding social context in legal decisions. The next generation of lawyers learned to see justice through a wider lens. The healthcare sector's integration continued to deepen. Matthew Robinson worked with John Lewis to establish medical screening protocols at every point of contact with the justice system. Daniel Clark managed a team of healthcare navigators who ensured that medical needs were addressed promptly and effectively. The media's interest evolved from covering a unique story to documenting a movement. James Martinez produced a documentary series following several cases through the new system. Anthony Jones wrote a series of articles examining how the approach was changing lives across the community. The coverage helped spread the model to other jurisdictions. Sandra Williams' personal transformation remained central to the story. Now employed full-time at the courthouse's resource center, she worked with Mark White to develop peer support programs. Her experience helped others understand that seeking help was a sign of strength, not weakness. The statistical impact continued to impress observers. Christopher Brown's analysis showed significant reductions in recidivism rates among program participants. Joseph Smith found that the community's perception of the justice system had improved dramatically. Trust replaced fear as the predominant response to court involvement. Even the physical space reflected the philosophical changes. William Thomas worked with Nancy Anderson to create an environment that emphasized hope and help over punishment and fear. The courthouse's imposing facade now featured clear information about available resources and support services. The change in prosecutorial culture was perhaps the most profound transformation. Lisa Garcia, training new attorneys, emphasized the importance of understanding context before making charging decisions. Sarah Wilson developed protocols for identifying cases where intervention would be more effective than prosecution. The ripple effects reached into unexpected areas. Margaret Lopez, managing emergency services, reported that hospital emergency rooms were seeing fewer crisis cases as preventive services became more accessible. David Lewis coordinated with Robert Wilson to ensure that mental health support was readily available throughout the system. The business community's continued evolution proved crucial. Elizabeth Martinez worked with store owners to create help points, where people could connect with resources before reaching crisis levels. Barbara Rodriguez managed a network of volunteer mentors who helped people navigate available services. The impact on families extended beyond individual cases. Mary Thompson coordinated with Karen Davis to ensure that children's needs were considered in every intervention. The system learned to see family stability as a crucial factor in preventing future issues. Sandra Williams' daughter, now 6 months old and thriving, became a symbol of what was possible when justice wore a compassionate face. Patricia Anderson organized a support network for other expectant mothers facing similar challenges. The community that had come together around one case continued to grow and evolve. The program's success attracted national attention. Linda Hernandez coordinated visits from justice officials across the country. Charles Miller developed training materials to help other jurisdictions implement similar approaches. What began in one courtroom was becoming a model for national reform. The transformation of the justice system continued to deepen. Susan Jackson managed new initiatives focusing on early intervention in schools and community centers. The goal shifted from responding to crime to preventing the conditions that led to desperate choices. Even the language of justice changed. Michael Johnson noticed that terms like defendant and perpetrator were increasingly replaced by community member and participant. The shift reflected a deeper change in how the system viewed its role and purpose. As the 6-month celebration concluded, Usha Vance finally took the podium. Her words captured the essence of what had been achieved. True justice isn't about punishment or retribution. It's about seeing the humanity in each person who comes before us and having the courage to respond with understanding and help rather than just judgment. The legacy of that one courtroom moment continued to grow. Sandra Williams' story had become more than just an example of compassionate justice. It had become a blueprint for systemic change. The question was no longer whether this approach worked, but how to expand its reach and impact. Have you witnessed a moment when compassion transformed an entire system? Share your experiences in the comments below. Sometimes the most powerful changes begin with one person choosing to see beyond the surface and respond with understanding rather than judgment.